Hello, my name is Noah Wilt, and I am going to be discussing my research proposal. So the research question I explored was, do spiritual interventions along with cognitive behavioral therapy increase the likelihood of recovery from alcohol addiction? So addiction continues to be a growing problem in the United States and even globally. It seems like there's no relief in sight. Despite all the knowledge we have currently on addiction as a disease, there is a lack of research on spirituality and spiritual interventions as a form of treatment. The use of spiritual interventions isn't something that isn't seen. Groups like Alcoholics Anonymous and Narcotics Anonymous have been using spiritual principles for decades, and that was noted by Lund 2016. The Alcoholics Anonymous Fellowship has approximately 1.2 million members. 73% of the members report over a year of abstinence with consistent meeting attendance, as noted by Gatlinger 2017. The use of spiritual interventions in recovery fulfills a search for meaning and personal identity, as noted by Dermatis and Gatlinger et al. 2015. Some people discuss with addiction, it's caused by a void or not having a relationship with God. So the void is filled with addiction. Drugs and alcohol fill that void. And when we introduce spirituality and build our relationship with God, then that starts to fill that void and there's no longer need for substances. So the null hypothesis for my study is that spiritual interventions have no effect on sobriety and recovery for those diagnosed with alcohol use disorder. The study design I utilized was the between subjects experimental design. Due to subjects being assigned to different experimental conditions to measure a difference, that's why I wanted to use that. They're going to be assigned to different treatment groups. So there's going to be a cognitive behavioral therapy group alone, and then a cognitive behavioral therapy group along with spiritual interventions. So looking at the participants for the groups, it's going to be adults ages 18 to 35 who are entering substance abuse treatment for alcohol use disorder. Participants are going to be gathered by convenience sampling for substance abuse treatment referral. So clients that are getting referred to a clinic and meet the criteria for alcohol use disorder. The use of convenience sampling is chosen because it's convenient, it's going to be cost effective. So the inclusion criteria, of course, again, they have to be ages 18 to 35. They have to meet criteria for alcohol use disorder, moderate or severe. They should be able to read, speak, and understand English. And the most important thing is they must be willing to include spiritual interventions as a part of treatment. It's important that we see that our participants are willing to do that because not everyone is willing to do that. Not everyone is spiritual. Some inclusion criteria are we're going to not want anyone who is experiencing suicidal or homicidal ideations or behaviors. No one's suffering from psychosis or acute intoxication or withdrawal symptoms. So the instrument used for this study is going to be the alcohol use disorder identification test, also known as the audit. So the purpose of this instrument is to look for problematic drinking behaviors or hazardous drinking behaviors. The audit is a 10-item self-report questionnaire. It can be completed either via pen and paper or in an interview style. This test has significant reliability and it has good test-retest reliability as well as internal consistency. So the statistical analysis used for this study is going to be a between groups t-test. The rationale for using this would be that we're looking at a continuous dependent variable being measured throughout the experimental groups. The data for the audit would also present two group means, so that makes the between groups t-test appropriate as well. We're going to get results that are going to show a t-score and a p-score, a p-value, t-value, and p-value. So when we look at the t-value, if the t-score is large, it will show the groups analyzed are different. But if the t-score value is small, it will show that the groups are similar. On the other hand, when we look at the p-value, it measures the probability that the data occurred by chance. And for social sciences, we're going to look for a p-value that's less than 0.05, and that says that the results are clinically significant. If we get a p-value that's less than the 0.05, it is showing that the results are significant and it's going to present evidence against the null hypothesis. When we look at the t-value, if we have a large t-value, it's going to show that our groups do show difference. So one is more effective than the other. If we get these results stated, we're going to reject the null hypothesis, and ultimately this would identify that spiritual interventions, in addition to cognitive behavioral therapy, are effective in treating patients with alcohol use disorder. Thanks.